Welcome everyone to tonight's webinar. My name is Arlene Walker and I'll be your moderator for this evening's session. We'll be emailing you Dr. Meschino's presentation recording after the webinar, so you won't have to take notes because you'll see the slides are embedded in the recording once you receive it. So also we've set aside a half hour after the presentation for questions and answers. You'll be typing your questions into the chat box at the bottom of the Zoom window. Sometimes you'll find that questions you may have are answered as Dr. Meschino moves through the presentation. So I recommend that you make a note of your questions during the webinar and type any unanswered questions into the chat box at or near the end of the presentation. Before we begin, I'd like to tell you about our presenter, Dr. James Meschino. He's the author and co-author of 4 nutrition, wellness, anti-aging books, including the Meschino Optimal Living Program, 7 Steps to a Healthy, Fit, Age-Resistant Body. He is an associate professor in the Division of Physiology and Biochemistry at the Canadian Memorial Chiropractic College, where he has taught courses on nutrition and biochemistry since completing a master's degree in nutrition and biology in 1984. He has also taught nutritional medicine courses for the American Academy of Anti-Aging Medicine, the American Council on Exercise, and the Global Integrative Medicine Institute. Having published over 150 reviewed papers on nutritional and lifestyle medicine in the prevention and complementary management of common degenerative health conditions, Dr. Meschino has established himself as an expert on the evidence-based application of nutrition and lifestyle practices in disease prevention, management, and anti-aging. He's also taught numerous corporate wellness programs to Canadian and American companies and firms, appeared on many TV and radio shows, including his Detroit PBS special, Healthy Aging Naturally, and most recently has developed a leading-edge digital wellness coaching platform for employee group health benefit plans and related wellness programs. He's also the formulator of Adëeva Nutritionals supplement products sold in Canada and the United States. On behalf of Adëeva Nutritionals, I want to thank everyone for attending this evening as Dr. Meschino presents this very timely research-based webinar on Is Your Multivitamin and Mineral Everything It Needs to Be? I'll now hand this over to Dr. Meschino.
Thank you, Arlene. That was a very nice introduction. I appreciate it very much. So welcome everyone for who's on the call to the webinar this evening. We had a lot of people register for this. Many people, they know that if they don't get to the live version that we send the recorded version out. So we have quite a large number of people interested in this topic, actually. So I'm very happy to present it. This is a very meaningful webinar from my standpoint. Sort of, is there research to support the use of a multivitamin? And if multivitamins can be helpful, then, what kind of dosages are the meaningful dosages? And that's what we really want to examine here today. So without further ado, let's get started. Very often you'll see media reports where they'll quote certain studies showing that people who take multiple vitamins, there's no benefit to them around cancer, heart disease, or whatever they're looking at. But basically, they're looking at people who are taking your everyday sort of low-dose drugstore vitamins that are not enriched with antioxidants. They don't have significant amounts of vitamin D or calcium or selenium or a B50 complex. So in those studies, very often those vitamins don't show a great benefit, and sometimes no benefit. But the story is very different when people are supplementing with meaningful doses of specific nutrients, and that's what I'm going to show you today. So this presentation includes studies that are found in peer-reviewed clinical and scientific research papers that the medical profession would read, showing that that meaningful doses of certain key vitamins and minerals taken on a daily basis really does translate into better health outcomes. So that's what I want to show you today. And you'll see in this presentation the different links to the actual research paper themselves. But if you had to sort of summarize the human clinical studies that support the use of a high potency multivitamin and mineral and its applications, what you start to see is that if it's properly formulated, that it can slow down certain aspects of the aging process and quench damaging free radicals that can do a lot of damage to us. Strongly associated with helping to reduce risk of Alzheimer's and Parkinson's disease. I will show you all of this research. Reducing risk of macular degeneration, the leading cause of blindness in people over the age of 55. Preventing and slowing the development of cataracts, also a common eye problem as people age. Even slowing age-related hearing loss. You know how common that is. And reversing some genetic types of hearing loss, right, which I'll show you the research on that as well. Also, the right dosages help to optimize your immune system and decrease risk of infections or how virulent the infection is going to be if you contract one. Also, improving recovery from infections if you happen to develop those infections, both in situations related to pneumonia, and more recently, you'll see studies on COVID-19, which I will show you. Also, in breast cancer survivors, in women who are, 4 studies have shown this now, women who are using certain types of vitamins and minerals at certain dosages, the risk of recurrence is much less. Slowing down the rate at which your brain shrinks as you get older is related to vitamin supplementation, as I will show you, and helping to preserve memory so you don't lose it as you age. Part of that has to do with vitamins and minerals. Not every aspect of it, but a certain part of that you will see is linked to these nutrients. Also, as an adjunct to the treatment of certain mental health disorders like depression and depression in the elderly, certain vitamins and minerals can be very helpful in conjunction with medication to improve the efficacy of the medication. Also, preventing osteoporosis. That's 1 in 4 women over the age of 50, 1 in 8 men over the age of 50 develop osteoporosis, very serious problem. Also, the mother's status of certain nutrients during pregnancy strongly determines not only the success of the pregnancy, but also how intelligent her offspring are going to be in terms of IQ, as I will show you. Also, you need nutrients at certain dosages for wound healing and to decrease what tends to happen as people get older is they can't taste their food as well. They have so age-related decreased taste acuity. Older people say, I can't taste my food that well. You're going to see why. Also, preserving your night vision ability, as certain nutrients are very important. And the nutrients that are important, often we don't get them at ideal dosages. Supplementation plays a big role in preserving all of these functions, including maintaining blood sugar regulation, as you will see. The mineral chromium seems to play a role in this. So let's start with what I'm talking about here and go through this. I'm going to move fairly quickly. You'll get the recorded version later. But what I said is that certain nutrients can help to prevent free radical damage to the body. And free radicals are, the best example is how you have oxygen in the air. And if you cut an apple in half, the apple will start to turn brown after a while because oxygen acts like a free radical, causing damage to it. But you know that if you squeeze lemon juice on the apple, it's going to slow down the rate at which it turns brown. That's because the lemon juice has vitamin C, which is an antioxidant. So antioxidants can sort of quench sort of free radicals that cause damage to the apple, but also in our bodies because we're using oxygen. We need oxygen for energy, of course, but oxygen also causes some corrosive free radical damage over time, and antioxidants can help to slow that process down. So there's all kinds of sources of sort of free radicals. You get it from oxygen, but also from ultraviolet light, which can damage our skin and damage our eyes. Air pollution, ionizing radiation from, CAT scans, X-rays. Also, inflammatory processes in the body, smoking, of course, secondhand smoke. It all generates free radicals, including oxygen, that can damage our genetic material, lead to aging of the cell, but also lead to mutations that can lead to cancer. So there are antioxidants that can actually quench these free radicals. And the body knows that, it needs some antioxidant protection. So your body makes some antioxidant enzymes and molecules on its own to help quench them. But the body also needs nutritional antioxidants from food and supplements for more complete protection against oxygen and other types of free radicals that we're exposed to almost every day of our lives. And that slows down the rate at which our bodies get damaged by free radicals by optimizing antioxidant status. So that's what antioxidants do. That certain, like vitamin C and vitamin E and selenium and beta carotene, as you will see, all seem to play a role in slowing down oxidative stress or free radical damage. So there's all kinds of great antioxidants in food that should not be ignored. Eating lots of fruits and vegetables that are loaded with antioxidants is extremely important as a foundational step. And then supplements sort of come in as on a secondary level. So there's some great antioxidants found in all kinds of fruits and vegetables. So eating a wide variety of them, all different colors, orange, yellow, green, purple, the wider the selection of the colors, the more antioxidants you're getting essentially. But supplements over and above that type of dietary intake shows tremendous benefit, as I'm going to demonstrate to you. There's other sources of free radicals besides oxygen, as I was talking to you about. When you barbecue things on a barbecue, you get these polycyclic aromatic hydrocarbons. They're found also in smoked meats. When you char foods, you get these heterocyclic amines. A lot of processed meats have like nitrates in them, which can lead to nitrosamines. This can cause free radical damage. Alcohol is an unbelievable source of free radicals. You should try to minimize your alcohol intake. It's linked to a lot of cancers that, this is not a popular thing to be telling people about, but alcohol after cigarette smoking is the second most important cause of cancer from the environment. And then, of course, smoking is a significant risk. And then air pollution and, radiation. The sun, of course, sun can damage your skin and your eyes. So you have to be very judicious in how much ultraviolet light you're exposed to. But antioxidants that you ingest can help to actually decrease some of that damage from the inside out, believe it or not, in addition to putting on sunscreen. And it also helps to protect your eyes. And also radiation comes from CAT scans and x-rays and sun tanning beds. All these things create sort of this type of ultraviolet light or radiation damage to the body. And free radicals don't just damage one thing. Free radicals can damage your DNA, which can lead to mutations. Those mutations can speed up the rate at which you age, but they can also create mutations that lead to cancer. Then free radicals can also damage the energy factory in the cell called the mitochondria. So over time, you have less energy. The energy factory doesn't work as well. You can damage enzymes inside the cell. You can damage the outer skin of the cell called the cell membrane. All these effects make your cells age faster. They become less functional as you get older. Certain parts, certain cells in your kidney and your pancreas and your thyroid stop working because the cells are so damaged. Even if you don't get cancer, the cells don't function the way they were designed to, and that leads to age-related changes. You can also damage the cholesterol in your bloodstream, make it more likely to stick to the walls of the artery if they're damaged by free radicals. In your eyes, cataracts, macular degeneration. In the brain, free radicals are linked to dementia and other neurodegenerative conditions like Alzheimer's and Parkinson's disease. Your skin exposed to ultraviolet light, you have wrinkles and also skin cancer, which is, that as you get older, the risk of skin cancer is very significant. You need to be always in having these things up top of mind to decrease prevention. And also free radicals damage the hearing mechanism in the ear, leading to age-related hearing loss. So the good news is that antioxidant nutrients from food and from supplements have been shown to actually decrease the damage that these free radicals can do by quenching them, neutralizing them so they can't be as damaging. So are there studies to show this? Well, I'm going to show you the studies on this right now. So here's one study. This was called the Alzheimer's Cooperative study back in 2000. They took people with early stage Alzheimer's disease. They gave half the group vitamin E at 2,000 IUs a day. The other group got the placebo. Remember that the brain is using 20% of the body's oxygen at any given time. So the brain really is can be damaged by free radicals in a big way. So can antioxidants slow that damage down and have an effect even on people that have Alzheimer's disease? And the studies showed quite convincingly that that the group that got the vitamin E, it significantly slowed the progression of their disease compared to the placebo group, where the disease caused deterioration at a much faster rate. So then they said, well, is it safe to use vitamin E supplements with drugs that people take for Alzheimer's disease? So they did a study in 2009 where they gave half the group, 2,000 IUs a day of vitamin E. The other group got the Alzheimer's drug, and the other group got vitamin E and the Alzheimer's drug, and another group got the placebo. And the studies showed that the group that got the vitamin E, it reduced their mortality by 23%. The group that got the drug alone, it actually increased their mortality slightly. But the news here that I want to shed light on, it's not that the drugs are bad. The drugs are not bad. The group that got the vitamin E and the Alzheimer's drug at the same time concurrently had a 30% reduction in mortality. That was the best result. Sometimes combining medication with supplementation can actually enhance the overall health outcome. And unfortunately, that aspect is rarely taught in medical schools. So you have to find other experts like myself who are on top of this research to sometimes fill in the missing part of the story. Then we look at antioxidants and macular degeneration. So there's this huge eye disease study back in the year 2001 following over 3,600 individuals that had early stage macular degeneration. And they tried giving them different kinds of supplements to see if it could help. And they said, oh, look at this. When we give the group that got vitamin C at 500 milligrams of vitamin E at 400 IUs and beta carotene at 25,000 IUs and additional zinc and copper, this group, it significantly slowed the progression of their disease relative to any other intervention. This is important because there aren't a lot of good therapies that can slow the progression of macular degeneration, which is the leading cause of blindness in people over the age of 55. So here you have studies with antioxidant supplements showing it can slow the progression of these serious diseases, Alzheimer's disease, macular degeneration, and now you see with cataracts the same thing. Studies have shown that people taking vitamin C and vitamin E and selenium supplements over a long enough period of time at doses that are higher than you would get from just a one-a-day multiple vitamin from a drugstore. I'm talking about significant doses now, 500 to 1,000 milligrams of vitamin C each day and 200 to 400 IUs of vitamin E. So we see that when you take significant dosages of these antioxidants, they're able to quench free radicals much more effectively and produce much better outcomes. Same in Parkinson's disease, a 10-year study showing supplementation with meaningful doses of vitamin C and vitamin E, delaying the need for drug therapy in people with Parkinson's. So not every study in Parkinson's has actually shown this. This is one of the studies where we got a positive effect. But what we have seen is that supplementation with vitamin C and vitamin E is associated with a decreased risk of developing Parkinson's disease. In other words, 1 in 500 Canadians develops Parkinson's disease as they get older. If you want to be in the lower risk group for developing Parkinson's disease, you would be a person who's taking vitamin C and vitamin E supplements on a daily basis at meaningful levels, according to the published data, and you see the links to the research there. And the other thing is that with vitamin C, it's not only an antioxidant, but it tremendously supports the body's immune system. And when you look across the population, you see that it's very common for people to have low levels of vitamin C, under 23 micromoles per liter, and an overt deficiency of vitamin C is actually the fourth leading nutrient deficiency in the United States. But in the most recent National Health and Nutrition Examination survey, where they look at children and adults across the population, almost 40% have low levels of vitamin C, below 23 micromoles per liter. And 88% of the population don't get the vitamin E they need, and vitamin E and vitamin C work together. So what we see now is that to enhance immune system function, that even young, healthy people need to be getting 250 milligrams a day of vitamin C in order to keep their immune system strong. So if you're getting a regular multiple vitamin from a drugstore, it's probably going to have like 60 or 100 or 90 milligrams of vitamin C. That's actually not enough. And you're not getting 250 milligrams a day of vitamin C from food, I can guarantee it. What we know for sure is that people with stronger immune systems have a blood level of vitamin C that's at or above 50 micromoles per liter. To get there, as a young person, you need at least 100 to 250 milligrams a day. And as you get older, because vitamin C has to be pumped into your white blood cells, and that pumping action is not as efficient, as you get older, you need higher amounts in your bloodstream. So people who are older need 1,000 milligrams of vitamin C to maintain normal and healthy immunity, and they need at least 200 IUs of vitamin E each day. You can't get that from food, and you don't get that from a low dose drugstore type multiple vitamin. Studies show that fighting the common cold often is benefited with vitamin C supplementation. And if your blood level of vitamin C is below 45 micromoles per liter, and you start taking vitamin C supplements at meaningful doses, 500 to 1,000 milligrams a day as an example, it likely will reduce the frequency at which you even get the common cold. So also 1,000 milligrams a day, during an infection also helps to reduce the likelihood that you'll end up in a vitamin C depleted state, because when you get into a vitamin C depleted state, the infection can actually get more traction. So this was really shown in a couple of hospital studies where you had elderly people that had pneumonia who had low levels of vitamin C because it was depleted by the infection. So they said, let's try giving them vitamin C to see what happens. And they said, look, in these severely ill pneumonia patients, when we gave them just 250 to 800 milligrams a day, it reduced the hospital stay by 19%. And when we gave them higher doses, up to 1,600 milligrams a day, it reduced the hospital stay by 36%. And not only was the person feeling better, but the chest x-ray cleared it. The infection was gone from the chest. Their temperature came down, and other blood tests to look for infection, like the erythrocyte sedimentation rate, also reduced dramatically in the group that got vitamin C supplementation. So when you see these media reports that, vitamin supplements don't do anything, I have no idea why they're reporting this. Then we look at vitamin E Succinate, a specialized form of vitamin E in cancer prevention and treatment. So vitamin E Succinate is the only form of vitamin E that demonstrates experimentally, and now in one really important case study that I'm going to show you, an ability to block steps that are involved in the development of cancer. So when you have vitamin E succinate, just that form of vitamin E, not the other forms, we see that when you look at human cancer cells that are treated with vitamin E, it tends to cause them to commit suicide, or it blocks their replication significantly. More than at least 50 types of human cancer cell lines actually show this incredible effect. So they said, well, maybe it might be beneficial against mesothelioma. So mesothelioma is a type of lung cancer caused by exposure to asbestos or asbestos dust. And so they said, well, in the experimental studies we have, vitamin E succinate is able to actually get those tumors to commit suicide, those tumor cells, which is an incredible thing. So they said, well, let's just see how this works. So they're saying, well, experimentally, what seems to happen is it encourages it damages the cancer cells. It leaves the healthy cells of the body alone, but it causes the cancer cells to become so damaged that they undergo programmed cell death, or a type of suicide that we call apoptosis. So they said, well, let's just try it in a human case. So in the journal Oncogene in 2008, they took a patient that had mesothelioma and they gave them vitamin E succinate at a significant dosage. And they saw that the tumor in the chest was shrinking and the person was feeling much better. So they said, okay, so based upon that, they're now in the process of doing some larger studies to confirm the findings. But this is remarkable because there are no medical treatments right now available that are meaningful in the treatment of mesothelioma. So what we understand is how vitamin E succinate is working in mesothelioma, where this is the short form for vitamin E succinate. And it comes in and it stimulates a number of pathways that go down that basically lead to what's called apoptosis, where this cancer cell will commit suicide, but it does it selectively. The other healthy cells around it don't commit suicide, only the cancer cells, which is, it's hard to make a cancer drug that can do that. So vitamin E succinate, if I'm going to take vitamin E each day of my life, and I do, that's the form I want to be taking. And then in 2021, this study was just published recently looking at human cervical cancer cells. So, human cervical cancer is still I think 300,000 women worldwide still die from cervical cancer each year. So in cervical cancer cells, it was able to decrease the expression of certain receptors that normally would impair the ability of the immune cells to kill the cancer cells. When you gave those cancer cells vitamin E succinate, they were not able to express that type of receptor, so the body's immune cells could come and kill the cancer cells off. So there's other mechanisms now that are surfacing that demonstrate that vitamin E succinate may have other ways that it actually helps to defend against these steps that are important in cancer prevention. So there's more research that's required, but if I'm going to take vitamin E, and I do, I want it to be in the form of vitamin E succinate based on the available research today. Then we have these incredible human studies looking at breast cancer survivors. So the first one was back in 2011, a 2-year follow-up study of breast cancer survivors, and they showed that women who were in the top 25% of having a healthy lifestyle, the ones that took a multiple vitamin had a 60 to 70% reduction in risk of dying from any cause during the study versus women who had the same lifestyle habits but weren't taking a multiple vitamin. And these usually they're using antioxidants as part of the multiple vitamins. So in 2012, another study looking at the same thing, over 2,000 women who are breast cancer survivors, and they showed that after a 5-year follow-up, the frequent use of vitamin C and vitamin E in the period following breast cancer diagnosis was associated with decreased likelihood of breast cancer recurrence. We also observed the frequent use of vitamin C and E after the diagnosis was associated with reduced risk of all-cause mortality. In other words, dying from anything, as well as decreased risk of breast cancer and breast cancer recurrence. 2011 in China, the Shanghai breast cancer survival study showed the same thing. Almost 5,000 breast cancer survivors. They looked at the ones that are getting antioxidants at significant doses in the after the breast cancer treatment. Average follow-up 4 years. An 18% reduced mortality and 22% reduced risk of recurrence versus women who are not taking supplements. What they said is our results do not support the current recommendation that breast cancer patients should avoid vitamin supplements. They're saying, some doctors say, if you've had breast cancer, stay away from these supplements. The studies show the actual opposite, that these supplements can actually lead to better survival. Then there's age-related hearing loss, as I was alluding to earlier. Studies show that free radicals over time damage the hearing mechanism in the ear that is a major contributing factor to age-related hearing loss. Animal studies show that you can slow that process down. Now we have human trials that have shown that antioxidant supplements, not antioxidants from food and spinach and strawberries, people who are taking supplements of antioxidants, meaningful doses, were able to preserve their hearing even if they were treated with chemotherapy drugs, or in the aging process, or they already had tinnitus, or they had noise damage from other free radicals related to hearing loss. So even human studies are showing this now. Antioxidant supplements can help to prevent hearing loss from all different types of causes, including in individuals that have genetic mutations that are causing their hearing loss. They gave some of them antioxidants of, vitamin A or beta carotene, vitamin C, vitamin E, magnesium. And so these, they showed a specific case of a child with this particular genetic type of hearing loss observed over a 7-year period. Giving the antioxidant supplements with also magnesium, the individual showed, a tremendous amelioration in progressive hearing loss, that he had a genetic predisposition and was already experiencing the symptoms of. Only antioxidants were able to prevent that from getting worse and help to correct it to some degree. Then there's B vitamins and brain. So what we see from the Oxford project to investigate memory and aging, they took these almost 170 individuals over the age of 70 years old who already had mild cognitive impairment. They already have early stage type of dementia. They're becoming very forgetful. The next stage is full-blown Alzheimer's disease. And they broke them into two groups. They gave one group B vitamin supplements, folic acid, vitamin B12, and vitamin B6 at doses you can't get from food. You need supplements to get these doses. The other group got the placebo, and they wanted to measure, over time, how fast is the brain shrinking and what happens to their overall cognitive function. What they saw is that the group that got the B vitamin supplements, it slowed the rate at which the brain was shrinking by 30%. In some cases, it slowed it by 53%. And the more you preserve brain function and you stop shrinking, the better is your overall cognition. So the more the brain shrinks or undergoes atrophy, the lower becomes the cognitive test score. So if you can stop brain atrophy or brain shrinkage, you maintain better cognitive function. There are no drugs that have been able to do this. Only B vitamin supplements have been able to do this. So normally after the age of 60, in someone who's normal, there's still a bit of brain shrinkage that occurs about 0.5% per year. People with mild cognitive impairment, the rate of shrinkage of the brain is normally 1% per year. People with Alzheimer's disease, the shrinkage of the brain is 2.5% per year. So anything that can slow down brain atrophy or brain shrinkage becomes critically important here. So the only thing that's ever been shown to do it are B vitamin supplements. How do they do it? We think, well, it helps to prevent the rise in a damaging chemical called homocysteine, because we know the higher homocysteine level damage the brain and are strongly linked to Alzheimer's disease. But these B vitamins also help to preserve the function of the chemicals in the brain called the neurotransmitters that are required for normal everyday cognition, function, reward behavior, motivation, all these things that become critical. So thus far, only B vitamin supplements have been shown to slow brain atrophy in aging persons. No drugs or other lifestyle measures have been shown to do it. And it's especially helpful in people that have a homocysteine level that's already above 11 micromoles per liter, which is about a third of the population. And it seems to work well if you also add omega-3 fats into the combination with the B vitamins. Things are even better. Then there's the B vitamin niacin. Well, niacin is required by all the cells of the body, including the brain cells, to make energy. But niacin also helps to preserve certain structures in the brain cell itself called the tau protein. So the Chicago Rush study showed that of these, a significant number, almost 4,000 individuals who were older individuals living in Chicago neighborhoods, that you had people who had a daily intake of niacin that's at or above 45 milligrams a day. The only way you can get 45 milligrams of niacin a day is through supplementation. You can't get it from food. That they were 70% less likely to develop Alzheimer's disease than the group that had the lowest amount of niacin. And we sort of understand why. So if you look inside a nerve cell, there are like little pipes or they're called microtubules. And those microtubules are held together by what's called the tau protein. So I don't want to complicate things. We see these little blue tip things sticking up here. These are tau proteins holding together important parts of the brain cell structure. And if those tau proteins break down, everything collapses and you form neurofibrillary tangles, these clumps of these blue tangles here, which are a big part of Alzheimer's disease. The only thing to prevent the disintegration and breakdown of those tau proteins into neurofibrillary tangles that we've seen so far is niacin, and you need enough niacin to prevent it. So animal studies have made that very, very clear. If you breed mice to be prone to Alzheimer's disease, but you give them high doses of niacin, it tends to prevent the Alzheimer's disease from developing, and it also improves their memory and their cognitive function on different types of lab tests. So if you were to translate how much niacin does a human being need who's going into Alzheimer's disease based on the animal studies, it would be 1,000 milligrams 3 times a day. That's a very high dose. That's not something you can just arbitrarily do. You'd have to have medical supervision because high dose niacin can cause liver damage and some other problems. So you can't just take doses of niacin at that level. But in terms of my own personal perspective on this, based on the Rush study and the importance of niacin in preserving the tau protein inside your brain cells, getting 50 milligrams a day from a high potency multiple vitamin, I think, is critically important to help reduce the risk of those biological steps linked to Alzheimer's disease. We haven't seen any drugs yet that can stop the formation of neurofibrillary tangles. The only thing we've seen so far is that niacin at significant doses can do that. On the prevention side, it looks like 45 milligrams and above would be something to consider. If a person's starting into Alzheimer's disease, they would need higher doses, but that would have to be under supervision, medical supervision. And then vitamins and minerals, they play a role also in depression, making the drugs used for depression work better. In order to make these important neurotransmitters in the brain like serotonin and dopamine and noradrenaline, these are the things that help us function and make us feel good and create reward and motivation behavior, make us feel happy. In order to make these neurotransmitters, you need vitamins and minerals to do that. So what we're seeing is that when we look at depression studies, folic acid deficiency is strongly linked to depression and cognitive decline. Depression patients with low folic acid levels show a poor response to antidepressant drugs. Often a person takes drugs like Prozac or any type of selective serotonin reuptake inhibitor drug, an SSRI, and a lot of people don't respond to it. It doesn't help them. So who is it? Because the drugs are actually very good. The problem is that those drugs are slowing down the breakdown of brain neurotransmitters, but they don't help the brain actually make more of the neurotransmitters like dopamine and serotonin. And only supplements can do that. So in the people who don't respond to the drugs, it's often, as the studies are showing here in the Canadian Family Physician Journal in 2011, it's often because they had low folic acid in the first place. You give them folic acid in conjunction with their medication, very often the outcomes are much, much better. And lots of studies have shown that. A lot of people are walking around with suboptimal intake of folic acid from day to day. And if they're prone to depression, it's likely to trigger it in conjunction with other, environmental and interpersonal problems that may develop in life. But in order to treat it, in addition to the drugs, supplements become very, very important. Also, folic acid has been shown to reverse some cases of cervical dysplasia. So cervical dysplasia is a precancerous condition of the cervix. And we see that studies indicate that less than adequate levels of folic acid in the diet increase the risk of cervical cancer. This has been found to be particularly true in individuals who consume alcohol on a regular basis. Alcohol wash decreases folic acid status. As well, women taking oral contraceptives is a well-known risk factor for cervical dysplasia, and folic acid supplementation has been shown to reverse cervical dysplasia, which is a precancerous condition, in women who are taking oral contraceptives. You get the folic acid back in at the ideal doses. The cells start to, when they replicate, they become more normalized again, and you help to reduce the likelihood of cervical dysplasia from becoming cancerous. So I want to make the point that if you have cervical dysplasia and they recommend medical treatment for it, you should definitely follow the medical treatment. I'm just highlighting these studies because it shows you how powerful these nutrients can be in just day-to-day cellular biology as it relates to these very important diseases. Then vitamin B12 and mental health is also a big factor. Up to a third of psychiatric patients, especially older psychogeriatric patients, have low folic acid and or vitamin B12 upon admission. In other words, that low level of folic acid that people tend to have as they go through life can really manifest itself in terms of decreased mental function as people get older, in terms of memory, personality changes, dementia, mood behaviors. Up to 20% of patients who are admitted, who are older, who have psychogeriatric admissions to hospitals, that means they have a mental health problem, they're being admitted to the hospital. Up to 20% have low levels of vitamin B12. And if you just get the vitamin B12 back to normal, very often the person's personality comes back. So why is it that we have more of a vitamin B12 deficiency as we get older? It's because the stomach makes less acid as we get older. You need stomach acid to help absorb vitamin B12 because the stomach acid causes the stomach to release more intrinsic factor, which you need for vitamin B12 absorption. Also, as people get older, they have more indigestion problems. They start taking antacids and other things that block the acid producing cells in the stomach. And so with less acid, you're absorbing less B12. And people tend to change their diet as they get older. They tend to eat fewer vitamin B12 containing foods. So slowly over time, your liver stores about 1 to 3 years of vitamin B12. Slowly over time, you start to lose some of that B12 and you end up in a marginal deficiency state that can lead to mental health problems. There's a classic example in the New York Times where you have this gal who notices that her mother, who's aging, starts to have memory loss and personality changes, goes to the doctor. Doctor says, I think it's dementia, early stage Alzheimer's, but let's just do some blood tests to be sure. He finds out that the mother has low vitamin B12, starts giving her vitamin B12 injections, and within weeks, she's good as new again. So these nutrients play a huge role. So in 2005, there was a review paper on all of this in the journal Psychopharmacology. And what they said is both low folic acid and low vitamin B12 status have been found in studies of depressive patients. Low blood levels of folic acid has also been found in patients with recurrent mood disorders who were treated with lithium, right? And in depression due to alcoholism. Low folic acid levels are furthermore linked to poor response to antidepressants, and treatment with folic acid is shown to improve response to antidepressants. A recent study also suggests that high vitamin B12 status may be associated with better treatment outcomes for all kinds of individuals with certain types of mental health challenges. There's now substantial evidence of a common decrease in serum or red blood cell folic acid levels and serum vitamin B12, and an increased plasma homocysteine in patients who are depressed. When your folic acid levels and your B12 levels are lower, your homocysteine tends to go up. On the basis of current data, we suggest that oral doses of both folic acid and vitamin B12 should be tried to improve treatment outcomes in patients who have depression. That was published in 2005 in the Journal of Psychopharmacology. I think the thing is, don't allow yourself to become deficient in these things in the first place. Taking a high potency multivitamin every day can guard against you ever getting into this decreased state. And the other thing is that folic acid and B12 are required to methylate your DNA. So you remember the double helix from high school, how your DNA is formed. You need to methylate certain aspects of the DNA. And to do that, you need folic acid and B12 for methylation. And when you don't do that, when you have less methylation going on, then you get into a state known as hypomethylation, which starts to lead to your genes becoming unstable, and it increases risk of cancer. So once you get into hypomethylation, not enough folic acid or B12 to methylate your DNA, that's one of the main ways that cancer is allowed to get started. There's lots of evidence to show that. So maintaining optimal folic acid and B12 every day is critical. Relying on food alone I don't think is a good bet. Same with vitamin D. The blood range that is ideal for vitamin D is between 85 nanomoles per liter and 150 nanomoles per liter. 68% of Canadians have vitamin D levels below 50. The evidence says that if you just get 1,000 IUs of vitamin D a day, you're very likely to get a blood level above 75. Now, some individuals might need more than 1,000 IUs a day to get there, but the idea is get your blood work done and see what your vitamin D level is. But between October and May, even on a sunny day, if you expose your skin to the sun, you're not making any vitamin D. That wavelength doesn't reach the Earth's surface. If you live in Canada, which is like the 40th degree latitude, we can't get access to that much sunlight that's required. So the further away from the equator you get, the less likely it is that you can make vitamin D during the winter months. So in Canada, the maximum amount of vitamin D they let you put into a multivitamin is 1,000 IUs a day, but that's a very good amount for most people. Vitamin D blood levels above 75 nanomoles per liter are associated with decreased acute respiratory distress syndrome in children, faster recovery from respiratory infections in adults, improved immunity right across the board. So your immune system works better. And low blood levels of vitamin D are associated with increased risk of COVID-19 deaths. All the studies in Europe have shown that low vitamin D, increased risk of death if you get COVID-19. So here's all the research if you want to link on those studies. And then in Spain, they're saying vitamin D, when it's supplementation, when it's added to the standard COVID-19 treatment in Spain, there have been no deaths as soon as they started adding vitamin D supplementation, and it decreased in the studies that they have, it decreased the progression of COVID-19 to the point where the person needs to be admitted to the intensive care unit. The other thing about vitamin D is that in the second trimester of pregnancy, if a woman's vitamin D blood level is suboptimal, then if it's below 50 nanomoles per liter, then it spells, but when the child is 4 to 6 years old, when they do IQ tests, they see that child is less intelligent. Vitamin D is required for brain development. So 13% of Caucasian women who are pregnant in the United States have low levels of vitamin D. 80% of Black women, 80%, this is ridiculous, 80% of pregnant Black women have low levels of vitamin D below 50. How can this be happening in this day and age? By the 12th day after conception, the fetal brain is already expressing vitamin D receptors. The vitamin D receptors are there for a reason. They need to be stimulated with vitamin D. Vitamin D crosses the placenta so the fetus can get access to it. So the new recommendation is that all pregnant women should know their vitamin D level, make sure it's in the ideal range. It needs to be really above 75 or 85 nanomoles per liter to be safe, because other conditions are impacted by vitamin D. When you have a vitamin D blood level at or above 75 to 80 nanomoles per liter, it's reducing risk of osteoporosis. It's linked to decreased risk of multiple sclerosis and type 2 diabetes, heart disease, high blood pressure, Alzheimer's, certain types of cancer, depression, Parkinson's disease, influenza, age-related macular degeneration. There's evidence for all of this. Those are the research papers if you want to go and read how strong the evidence is, but it's quite compelling. Then, of course, there's the osteoporosis story, the role of calcium. 42% of Americans, and probably Canadians as well, don't meet the estimated average requirement for calcium. 42% of the population. So we see that people are, who are at or over 60 years old, are getting 716 milligrams a day. For men, and women are only getting 563. You need to be getting 1,000 to 1,200 milligrams a day of calcium. Most people would benefit from an additional 500 milligrams of calcium a day from a high potency multiple vitamin. So what they say in this review paper in the American Journal of Clinical Nutrition, our results show that overall most U.S. adults do not meet the daily calcium levels that are being recommended in order to prevent osteoporosis. And this is a big deal because, as you lose calcium from bone in your spine, you start getting compression fractures and you start to get the Dowager's hump starts to form here. And then in your hip area, you'll start to lose calcium here. And the next thing you know, you fall and you fracture your hip. Well, you can't walk. So now you're in a hospital. And then when you can't move, fluid collects in your lungs, becomes a pooling ground for bacteria, and you die. 20% of women die in the first year after a hip fracture. 32% of men die in the first year after hip fracture, because men are older, more elderly when it happens. But 1 in 4 women and 1 in 8 men after the age of 50 in Canada develops osteoporosis. This is preventable. You need calcium, vitamin D, some resistance training, or enough body weight resistance to prevent that from occurring. Most people need an additional 500 milligrams of calcium a day and 1,000 IUs of vitamin D. And a high potency multivitamin can give you that. You don't have to buy all these things separately. And then we look at the studies on calcium and colon cancer. Studies have shown recently, as of 2014, that every 300 milligrams of calcium that you consume from food and or supplements reduces risk of colon cancer by 8 to 9%. So if you get to 1,200 milligrams of calcium a day from food and supplements, it helps to reduce osteoporosis risk. It's reducing colon cancer risk by 32 to 36%. That's important because the second leading cause of cancer death in this part of the world is colon cancer. So how does calcium help to reduce risk of colon cancer? Well, the calcium that you don't absorb slows down the rate at which the cells in the intestinal tract divide, slows down their proliferation rate. When you slow down the rate at which cells divide, they make fewer genetic mistakes that can lead to cancer. Also, the extra calcium will bind to bile acids that are in your intestinal tract, and that stops their conversion into these dangerous secondary sterols that tend to cause cancerous changes. Because these secondary bile acids, if they're allowed to form and they're exposed to the wall of the intestinal tract, it causes gene damage that can lead to colon cancer. There's tremendous evidence on this. So the additional calcium, getting to the ideal range of calcium intake, helps to block certain steps related to colon cancer development. No one talks about this enough. Then what about the carotenoid known as lutein that you get from sort of orange yellow vegetables? That's what makes those vegetables orange yellow. There's also lutein in dark green leafy vegetables, but the chlorophyll sort of masks the orange yellow pigment. But lutein has been shown to help reduce risk of macular degeneration. Lutein goes to the back of the eye and forms a sort of yellow area that protects the optic nerve from free radical damage from ultraviolet light. So there's evidence to show that 6 milligrams of lutein a day led to 43% lower risk of developing macular degeneration, because lutein, that's where it goes. It goes to the back of the eye, and that helps to protect against sunlight damage to the eye, so you can reduce your risk of macular degeneration. But most people don't get that much lutein from food each day. Supplementation makes a difference. Same with lycopene. We see all kinds of studies. Higher lycopene intake from tomatoes and other red sort of fruits and vegetables, strawberries as an example, watermelon. But more lycopene intake is related to a decreased risk of especially prostate cancer. So much so that there's now 6 studies where they took men that had prostate cancer at different stages and gave them lycopene supplements. Here's the first study. Here's the second study. Here's the third study. Here's the fourth study. Here's the 5th study. In all of these studies, the men that got the lycopene supplement to help to control their prostate cancer to a degree that allowed the other medical interventions to be more effective. I mean, lycopene goes to the prostate gland, concentrates there, and has tremendous effects on helping to preserve prostate cell health. Most men don't get enough lycopene from food alone. Lycopene's also been shown to help protect the cervix of the uterus in women. So we have some evidence there that I think is worth looking at as well. This was the 6th study, of course, where they used both soy isoflavones and lycopene together, got a great result. But we see that lycopene may also help reduce risk of other cancers in experimental studies that we have: lung, esophageal, stomach, breast, cervix, because those tissues concentrate a lot of lycopene. Most people don't get enough lycopene from food alone. Then there's a story of zinc. 55% of US adults don't ingest the recommended amount of zinc. And you don't store zinc, so you have to be getting it every day. Same with folic acid, you have to be getting it every day. Most B vitamins, you have to be getting that every day. 30% of older people have mild to moderate zinc deficiencies, because over a lifetime of not getting enough zinc, by the time you get older, you have a zinc deficiency that's significant. So the ideal blood level of zinc is 100 micrograms per deciliter, give or take 10 micrograms. So between 90 and 110. As soon as you're below 80, that's mild to moderate zinc deficiency. And a lot of people are there. And in third world countries, a lot of people are below 50, and it causes horrific problems where people die from diarrhea and infections because they can't get their zinc status up. So they're trying to improve zinc nutritional status in many third world countries. But even in our world, a lot of people have marginal zinc deficiencies that go undetected. So in order to guard against that, most men and women need at least 15 milligrams of zinc a day. But in North America, the average intake is only 11. In older people, it's only 8 milligrams a day. You say, well, that's close to 50. It's close, but it's not 15. So what happens is over time, you gradually develop a marginal zinc deficiency. You don't really notice it's going on. And then what happens to you over time is that your immune system's not as strong. You can't taste your food that well as you get older. Your eyes don't adapt to the dark very well. You lose your muscle mass, and you have poor wound healing. You ever seen an older person? They bang their leg against the coffee table, they get a bruise, and the bruise is still there. 9 months later, there's still a bruise there. These are obvious signs of marginal zinc deficiencies that catch up with people over time. Just don't let it happen in the first place. These are the references around zinc from all the peer-reviewed journals. And then the National Institutes of Health in the United States on February 3rd, 2021, they're saying, let's talk about zinc and COVID-19 specifically. Here's what we've seen. An observational study showed that COVID-19 patients had significantly lower zinc levels in comparison to healthy controls, and that zinc deficient COVID-19 patients, anybody below 80 micrograms per deciliter, tended to have more complications and potentially prolonged stays relative to patients who are not zinc deficient. So it was a much worse outcome for them. They're in the hospital, they're there for longer periods of time, their outcomes are worse. And they're saying, when your zinc status is low, it also allows the virus to start replicating and mutating within your body. Zinc helps to block that from occurring. So a lot of people just don't get enough zinc. You need 15 milligrams from a multivitamin every day makes great sense. Same with selenium. Selenium helps to support the immune system in a similar way that zinc does. We've seen that selenium supplementation helps to slow the progression of HIV, which is also a viral infection. It decreases the ability of viruses to mutate within the body. That has important implications here. And it also inhibits the life-threatening cytokine storm that can be a life-ending event when people have infections in their lungs. And it helps to prevent blood clots that we've seen in COVID-19 patients, according to a published study in the Frontiers of Nutrition in that journal in 2020. Selenium supplementation also has been shown to enhance the efficacy of the polio virus. And selenium supplements, selenium's studies have shown in experimental data and sort of observational studies is linked to decrease certain types of cancer, but we're still waiting for confirmation from human clinical trials. But in terms of COVID-19, what we've seen is that studies in China, Germany, and Sweden have shown that the lower a person's selenium nutritional status, the greater is the risk of mortality or death from COVID-19. In China, the rate of recovery from COVID-19 was shown to be 3 times higher in areas where people had higher selenium status. So the lower your selenium status, the worse the outcome. And in Germany, they saw the same thing. Lower blood selenium levels, higher mortality. In Sweden, 71% of elderly people have selenium deficiencies. So in Sweden, they started to take things into their own hands. They said, we're going to start supplementing our elderly people with selenium, and it reduced infections in institutional elderly very, very significantly. So the selenium recommended allowance each day is 55 micrograms per deciliter, but studies are showing now that to optimize immune system function, you need 200 micrograms a day. So in Sweden, where they give people 200 micrograms a day, that's where you saw this positive effect on immunity and lowering viral infection rates and cardiovascular mortality. And then we saw a published study in 2020 sort of confirming that. The role of selenium and even coenzyme Q10 in helping to reduce risk of cardiovascular deaths by 40%, and also the role of selenium in conjunction with that at 200 micrograms a day. And then there's all kinds of anti-cancer experimental studies showing the effects of selenium, all its anti-cancer properties. But again, we're waiting for human clinical trials on selenium to see if this translates into true benefit to humans. But in terms of improving immunity, selenium supplementation has already demonstrated efficacy in human clinical studies. Then there's vitamin A. We see that you need vitamin A for all kinds of reasons: to support your immune function, for vision, for reproduction, for cells to communicate, to prevent night blindness, for the normal growth of cells. But remember that 1/6 of all the beta carotene that you consume the body can convert into vitamin A if you need it. I'm bringing this to your attention for a reason. That is, if you ingest too much vitamin A in its sort of preformed state, it can actually create side effects that are very serious. So in a multiple vitamin, you should make sure you never take a multiple vitamin that has more than 2,500 IUs of vitamin A in a preformed state. It can have another 15 or 25,000 IUs of beta carotene. That's okay, because your body only converts beta carotene into vitamin A if your body needs the vitamin A. your body doesn't need the vitamin A, the conversion doesn't occur. So you limit your intake of vitamin A from supplements to 2,500 IUs a day. That's probably a good idea. And then the rest comes from the carotenes in food and the vitamin A in food, because too much pure vitamin A can be toxic to your liver and can cause bones to get damaged that will lead to osteoporotic fractures. I'm saying that because some multivitamins in the marketplace contain like 5,000 IUs of vitamin A, which is too much to be taking from supplementation. Finally, I just want to touch on chromium. That's a mineral that's been shown to improve blood sugar regulation. You know how type 2 diabetes has become an epidemic. Anything that we can do to improve our blood, the ability of cells to use blood sugar and keep our blood glucose down is beneficial. So studies show that by ingesting an additional 50 micrograms a day of chromium, it can help to improve the function of insulin receptors so the body can use blood sugar more effectively. So this is just a quick little diagram from a research paper showing that when the insulin attaches to a receptor, it allows more chromium to go into the cell. When chromium goes into the cell, it then binds to the insulin receptor from the inside, which makes it easier for blood glucose to go into the cell. So that lowers your blood sugar level. And that becomes very important. But if you don't have enough chromium in your body in the first place, then it doesn't get into the cell. So getting an additional 50 micrograms a day from a high potency multivitamin makes good sense to me. And then we have magnesium, which you know is very important for a variety of reasons. And magnesium gets washed out of your body by stress and alcohol, caffeine, exercise, eating refined sugars, a lot of things that, you know, people sort of are exposed to, or they part of their behavior patterns. So we know that getting a little more magnesium makes sense to compensate for the magnesium we tend to wash out of our body every day. And that magnesium, if you get extra magnesium, it's been shown to do some important things, possibly reduce risk of stroke. And some evidence shows that it may help to reduce risk of colon cancer as well. And the study here in the British medical journal called Gut, you know, magnesium intake of at least 255 milligrams a day was associated with a 23% lower risk of developing colon cancer, which is quite significant. So if I just want to summarize all this now, because we're getting really deep into the weeds, but I promise you I would show you the true evidence-based reason to consider a high potency multivitamin. So based on everything that I showed you tonight, what makes sense to me is to each day be getting the following dosages of these nutrients. I want to get 1,000 milligrams of vitamin C each day minimum, but because your body can only absorb 500 milligrams at a time, you want to get 500 milligrams twice a day. You want to get 400 IUs of vitamin E, but it needs to be vitamin E succinate, that form of vitamin E that I showed you earlier. You want to get at least 1,000 IUs of vitamin D, 500 milligrams of calcium, the B50 complex of all those B vitamins, zinc at 15 milligrams, selenium at 200 micrograms, vitamin A no more than 2,500 IUs a day to stop liver toxicity and osteoporosis, chromium at 50 micrograms, magnesium at 200 milligrams, and then some additional lutein and lycopene. So this is what I used to do. As all this research was sort of being discovered and explored and publications were occurring over the last 35 years, I used to take like a standard multiple vitamin that you'd get in a drugstore, like one a day or Centrum or something like that. These are not bad to start with. Then I added extra vitamin C, then I added extra vitamin E, then I added extra B50 complex, I added extra vitamin D, I added calcium, magnesium, I added selenium. So that's like 7 different bottles to get everything that I needed, and there's still no lycopene or lutein there. So when I became the product formulator for Adëeva Nutritionals, I thought I want to make this practical for people to do, including myself. So I put into one formulation all of those things that I just showed you. The 1,000 milligrams of vitamin C broken up into 2 divided doses, 400 IUs of vitamin E succinate, 200 micrograms of selenium, 15 milligrams of zinc, B50 complex, 1,000 IUs of vitamin D, lycopene and lutein powder, bioflavonoids, low-dose vitamin A, beta-carotene, chromium, calcium, and magnesium, and everything from A to zinc. You simply take 2 caplets twice a day. You've covered all of the terrain And so this is really the complete breakdown of the vitamin. When I say a B50 complex, I'm saying 50 milligrams of all the different B vitamins, right? Including folic acid, vitamin B12, and also biotin and thiamine, niacin. Remember we talked about niacin in the brain, stopping the formation of neurofibrillary tangles. It's all here. Vitamin E in the form of vitamin E succinate at 400 IUs a day. The 500 milligrams of calcium most people are missing, just low dose iron, so it's not toxic. There's the 200 milligrams of magnesium, 15 milligrams of zinc, 200 micrograms of selenium, everything down to lutein and lycopene. It's all there. So the Adeeva all-in-one multiple vitamin, if it's of interest to you, really replaces having to buy 7 or 8 different bottles the way I used to do it. It's antioxidant enriched. It has the B50 complex. It has the calcium and magnesium at ideal doses for osteoporosis and colon health. 1,000 IUs of vitamin D to help you get into that more ideal range. Everything from A to zinc, and vitamin E in the form of vitamin E succinate. So it's one bottle instead of 7 or 8 bottles. It's much less expensive than buying all 7 or 8 bottles. So it's even more cost effective to do it that way. So if that's of interest, I mean, the thing is, you can do it the way that I used to do. You can buy a standard drugstore multivitamin and add C and E and a B50 complex and selenium and zinc and lycopene and lutein and calcium and magnesium. You can do it that way. But to me, it's just so much easier to do it this way. So if that's of interest to you, Adeeva told me that I can explain to you that for attending this webinar today and registering, that until December the 13th at midnight, you can get 15% off of the multivitamin. And if you go to Adeeva.com and see anything else that you want, they'll take 15% off the entire order if you use the coupon code that you see here. So you don't have to write it down. They will send you an email after this webinar with the coupon code. The coupon code is not going to be active yet anyway. It'll be activated in a day or two. But when you get your email from Adeeva thanking you for attending today, the coupon code will be there and it'll be activated. So I want to thank you very, very much for sitting in today. I see that most of the people who started with me a little while ago are still on the call.